Once again, a warm welcome to you in this edition of the Morning Call. There are fears in Uganda over the spread of the Ebola virus. This follows the death of a 5-year-old boy who died on Wednesday after being infected with the virus. The first Ebola death recorded in the country. 2 of his relatives have also tested positive. According to the World Health Organization, 3 cases have so far been confirmed. The country's health ministry announced 7 other suspected people to have been infected are being monitored. It also says 50 people are suspected to have come into contact with the 7 people known to have contracted the deadly disease. Despite the situation, the health ministry in the country says that the DRC-Uganda border will not be closed.
3 new cases of Ebola have been confirmed in Uganda, a neighboring country to the Democratic Republic of Congo, officials said on Wednesday, June 12. On Tuesday, the World Health Organization announced that a 5-year-old boy had been diagnosed in Uganda, apparently after crossing over from the DRC. WHO officials said it was the first Ebola case in Uganda during the ongoing outbreak in the DRC.
The government has not done enough to sensitize people about Ebola. Because I think the acknowledgement should have started from the rural areas, direct, and it comes to the what? To the urban centers.
As per now, I'm safe because I haven't seen any symptom of Ebola. But I think the government should also continue to sensitize people about the Ebola. Since they have confirmed some 3 cases as per now, it means we are not safe.
Uganda's health ministry said the boy's grandmother and a 3-year-old sibling were also diagnosed with Ebola and were now in an isolation unit, adding the 5-year-old had died. The viral disease spreads through contact with bodily fluids, causing hemorrhagic fever with severe vomiting, diarrhea and bleeding. The current Ebola epidemic began in August 2018 in eastern DR Congo and has infected at least 2,062 people, killing 1,390 of them. The West Africa epidemic infected 28,000 people and killed 11,300, mostly in Liberia, Guinea and Sierra Leone.
In response to the Ebola outbreak in Uganda, a WHO emergency committee will meet on Friday to determine whether the epidemic constitutes a public health emergency of international concern. However, the final decision is made by the Director General of the World Health Organization.
That's right, Ruth. And Irene Nakasita is the spokesperson of Uganda Red Cross. She joins us to talk about this Ebola crisis that has now spread from the DRC to Uganda. Irene, thank you very much for accepting to speak to us today. So just as we've been saying, Ebola has been ravaging the neighboring Democratic Republic of Congo for a while now. Is this what you anticipated?
Well, I cannot say we really prayed or anticipated that we should have Ebola, but being close to the border of Congo, and of course our borders being open to people coming in from Congo and also doing a lot of business in Uganda, we really expected any possible outbreak, because as people come in and out, they are usually exposed. But we heightened our preparedness, I must say, since August last year. So for 10 months, considering that we had never registered any positive case, I want to believe our preparedness is really effective. But apparently, by yesterday, 1 case had been confirmed. By today, the case actually passed away. But then by this afternoon or evening, 2 more cases have been confirmed. So we must say we should switch from preparedness mode now to response, but also not forgetting that the usual activities that we're implementing at the border points and within communities have to continue, because we don't want to see further spread of this outbreak into the country.
One of the biggest challenges in the fight against Ebola is changing people's perceptions. Many patients refuse to be vaccinated for occult beliefs. Tell us how the inhabitants of Kasese react to these new cases.
Dites-nous comment les habitants de Kasese réagissent-ils à ces nouveaux cas?
For us, we don't anticipate any resentment. However, we also don't anticipate any uncooperation. But we continue as usual. We have established a relationship with communities within Uganda, and since they had actually never registered any positive cases, we can say maybe we want to see how people continue perceiving Ebola. We have always had information coming in from Congo that most of the people in Congo thought it was witchcraft, it is a myth, and that's why probably they have continued to even sometimes refuse to open up to the health workers and not declaring the susceptible cases until the time of death and actually going ahead to bury their own people and hence spreading the disease further into the community. But through our community engagement efforts, we have managed to include in rumor management for Ebola so that people can know some of the associated myths around it and how they should perceive it. In reality, if somebody dies, for us, we want to set a case that the teams that are trained in safe and dignified barriers will be the ones managing the barriers. And so there is a whole task force set up through the Ministry of Health in Uganda to manage that, and I'm sure we will continue emphasizing these sensitizations so that communities are able to take this up in good faith.
And Irene, the Uganda-DRC border not being very far away from each other, and it's not very far from the epicenter of the virus, and people are continuing to move around. Are you really tightening the measures that are already in place?
Apparently, the task force has, and we will wait to hear from the resolutions made because we had never registered any positive case. But as usual, the official border points have screening facilities. And so we expect everybody crossing into Uganda using the official border points to go through screening. However, we know that there are also porous border points or crossings which people are using and may enter unofficially. But the task force today that has started probably has come up with resolutions on how we are going to mitigate that. So we are waiting to hear the sense of direction that the government will give us, especially as partners who are involved in the preparedness and response activities.